July 6, 2026, WHO member states gathered once again to finalize the pandemic treaty, a process that has been ongoing for years. The recent Ebola outbreak has injected a fresh sense of urgency into these negotiations, reminding everyone that pandemic threats can arise unexpectedly. Despite previous setbacks and slow progress, countries are determined to reach an agreement that will better prepare the world for future health emergencies. The atmosphere is tense, with diplomats working late into the night, but the shared goal is clear: to ensure global safety and swift response. Although the pandemic treaty was agreed upon in May 2025, its key mechanism, the Pathogen Access and Benefit-Sharing (PABS) system, remains unfinished. This system is crucial for sharing access to dangerous pathogens and distributing the benefits, such as vaccines and treatments derived from them. The lack of progress has left the world less prepared than it could be, with diplomats from both wealthy and developing nations struggling to find common ground. The completion of the PABS annex is essential for ratifying the treaty and moving forward. Negotiations have been slow and exhausting, often stretching late into the night. Diplomats, especially those from smaller countries with limited staff, are feeling the strain. The seventh round of talks is underway, with hopes that this session will finally produce meaningful progress. The divide between wealthy and developing nations remains a major obstacle as both sides seek to protect their interests while ensuring global health security. The process is grueling, but the stakes are too high to give up. Chief Tedros Adhanom Ghebreyesus opened the talks with words of encouragement. He acknowledged the frustration and fatigue but urged countries not to give up. Tedros emphasized the importance of keeping the destination in sight, a future where pathogen samples and information move quickly and benefits reach those who need them most fairly and in time. His message was clear: persistence and cooperation are vital for global health. Ebola outbreak in the Democratic Republic of Congo, declared in mid-May, serves as a stark reminder that pandemic threats can emerge from anywhere. With over 1,500 confirmed cases and nearly 500 deaths, the outbreak has spilled into neighboring Uganda, highlighting the unpredictable nature of infectious diseases. Tedros warned that Ebola may not be the next pandemic, but its impact is a painful reminder that the threat never truly disappears. Deadly Hantavirus outbreak on the MV Hondius cruise ship, recently declared over, demonstrated how quickly danger can spread. The outbreak triggered a global health alert affecting 33 countries and territories. This event underscored the need for rapid information sharing and coordinated responses, as threats can arise in unexpected ways and locations. The world must be prepared to act swiftly to protect lives. Bogotá, the Umbro Monument stands as a tribute to medical personnel who lost their lives during the COVID-19 pandemic. This powerful symbol reminds us of the sacrifices made by healthcare workers and the importance of protecting those on the front lines. The monument is a call to action, urging countries to complete the treaty and ensure that future pandemics are met with better preparedness and support. Tedros reminded delegates that Ebola and other outbreaks are painful lessons. The threat of pandemics never truly goes away, and every delay in finalizing the treaty leaves people less safe. Real families and communities are affected by these decisions, making the completion of the treaty not just a bureaucratic task but a moral imperative. The world must learn from past crises and act decisively. Pandemic treaty was born out of the shock and chaos of COVID-19. Over 3 years of negotiations followed, as countries sought to prevent a repeat of the disjointed international response seen during the coronavirus crisis. The treaty aims to improve global coordination, surveillance, and access to vaccines, ensuring that the world is better equipped to handle future pandemics. One of the treaty's main goals is to foster global coordination. By sharing information and resources, countries can respond more effectively to health emergencies. Surveillance systems and rapid access to vaccines are key components, ensuring that no nation is left behind. The treaty represents a commitment to collective action and mutual support in the face of global threats. Pathogen Access and Benefit-Sharing (PABS) system is designed to ensure that benefits derived from pathogen samples, such as vaccines, tests, and treatments, are distributed fairly. This mechanism is vital for equity, making sure that all countries, regardless of wealth, have access to life-saving resources. The completion of the PABS annex will mark a significant step toward global health justice. Diplomats are feeling the fatigue from years of negotiations. Many come from small countries with limited staff, covering multiple branches of the UN in Geneva. The process is demanding, but the determination to reach an agreement remains strong. The world is watching, hoping that this round of talks will finally bring the treaty to completion. Tedros stressed the importance of fair access to pathogen samples and information. The goal is to eliminate needless delays and ensure that benefits reach those who need them most, in time and fairly. This vision requires cooperation and trust among nations, as well as robust systems for sharing and distributing resources. Only once the PABS annex is complete can countries begin ratifying the pandemic treaty. This step is crucial for turning the agreement into actionable policy. The world is eager for progress, knowing that every month of delay leaves people vulnerable. The completion of the annex will signal a new era of preparedness and cooperation. As talks continue, there is hope that countries will overcome their differences and finalize the treaty. The lessons of Ebola, Hantavirus, and COVID-19 are clear. Global threats require global solutions. With persistence and cooperation, the world can build a safer, more prepared future for all. The journey is challenging, but the destination is worth every effort.